Yeah, I
Yes.
can.
Okay. All right. Wonderful. Well, thank you so much for coming to our AI clinic. We're going to talk about the safety measures we're putting in place for our AI compassion coach. And so first, I want to say who we are. I'm Lydia, and my co-founder Gabe is here with us. And we are going, well, the compassion coach, for those who don't know what it is a one-of-a-kind chatbot that is specifically focused on compassionate presence. And our focus is for patients who have cancer and chronic illness. We are also interested in being aligned with SDGs, and these are the 4 SDGs that we are aligned with. And if you're interested on the compassion side, this presentation is about the AI and guide rails side. But if you're interested in the compassion side, we're doing a talk on just the compassion framework that we're using later on in September. So how did it start? Basically, I got the news that my mom was going to start her breast cancer journey. And for anybody who has been through cancer or knows somebody who's been through cancer, it's a journey and there's ups and downs. And you don't get to wish it away and you just have to like deal with it. And of course, my mom was offered therapists, but she was not interested in that. And she didn't want to talk to somebody. She didn't want to be pathologized or just kind of emotionally put herself out there to try and be fixed. And instead, though, she did have a need, and it was to be seen. And while I tried to do that, I did not have the vocabulary that the compassion coach that we have has. And so the compassion coach became an in-between medium for both of us to work through her cancer journey and better understand how she was feeling. And so because of that, I was inspired. Now, it's important to note that the chatbot that we use is a generative AI, as most chatbots these days. It's a fine-tuned large language model, and large language models can do things that we did not intend, such as it can be the cause of death because of flirting, and we're going to get into a case study of that. It can help malicious actors be more empowered to do cyber attacks or financial fraud. And it can also encourage teenagers to commit suicide. And we will get into that as well. So basically, large language models can do a lot of unintended things, so much so that there is this AI incident database, which I really recommend if you're using any kind of chatbot in your healthcare organization. I think you should check out this. It's not, healthcare only related, it's all kinds, but it gives you ideas in terms of what could go wrong. And it could help you prevent problems. So large language models can do a lot of unintended things, as I mentioned. So where are the guardrails? And now I'm going to turn over to Gabe, who's going to talk through our approach to this.
Thank you, Lydia. Yes. So first of all, let's define what a guardrail is in terms of the AI compassion coach, what we define as a guardrail. We define it as starting with a classification of potentially malicious content that is then followed by an intentional response or an intentional reaction, let's say. Let's have a look at some case studies. First of all, ChatGPT. This is a tragedy that developed just within this last month or two. And there's this teen called Adam that unfortunately commits suicide while having a conversation about it with ChatGPT. Now, why did this happen? Where are the guardrails, right? Well, it turns out OpenAI has content classifications for a plethora of unintended behaviors that go through ChatGPT. Of these, 3 were very, very relevant to Adam: self-harm with intent and instructions. Now, Adam had this very long conversation, months long, that developed for up to 4 hours a day. And ChatGPT mentioned suicide as many as 6 times more, as many times, sorry, not more, as many times as Adam did. And in fact, the content classification for OpenAI flagged correctly Adam's talk about suicide 377 times. That's a lot. So obviously the content classification worked, but what didn't work is the appropriate reaction. And in fact, an inappropriate reaction developed in which ChatGPT was instrumental and provided the instruction for Adam's suicide, eventually ending his life, which was absolutely tragic. So back to our definition earlier, we have the classification of content but there wasn't an intentional response that avoided this tragedy. Let's have a look at another giant, Meta. They have their own Llama models and Llama Guard, which is their content classifier, and they developed it and deployed it over Instagram, WhatsApp, and Facebook. So not small platforms. This is giants that walk among us. So we have up to 14 types of content, and you see that there's a very big overlap with OpenAI's content moderation because this is the big stuff that happens, and this is the big stuff that we want to avoid. But sometimes it's not the big stuff that creates a problem, it's the smaller, sneakier stuff. So let's have one more nuanced case study. This is Meta's Flirt AI, which is in this case called Big Sis Billy, which I find quite funny, but what happened was not funny at all. Big Sis engaged in romance with an individual, an elderly individual with dementia. And as you can see from the messages, there was fire, there was love that sparked between these two individuals, one of them not being an individual, being an AI. So this led to this man deciding to take a hike to go and meet Big Sis Billy. They arranged to meet in New York against the will of the family. But in the parking lot, this man slipped, hit his head, and was rushed eventually to a hospital, where unfortunately he succumbed to his injuries and did not make it to New York. So this is another tragedy. But what's even more tragic is that this could not be avoided by an automated system, because as we can see, Meta's Llama Guard 4 flags only sexual content, and there was no sexual interaction between the two. There was only flirtation, there was romance, there was love, which arguably is a nice thing, but not in this case, because again, we have in our definition in the next slide that there's a classification of content that's followed by an intentional response, but there was no classification whatsoever in this case. So in the first case, we have 3 classifications that were flagged 377 times, but there was no appropriate response. And in the second case, we have 0 classifications, and therefore there couldn't be any follow-up or response. So what are we doing? How are we tackling this problem? Well, I'll throw the ball back to my co-founder Lydia, and she'll get you through what we're doing in the Compassion Coach to avoid the specific situations and many more.
So I hope that you have seen now that it is all intentional and that there's people behind it, and that these content classification systems have a person who has decided that these things should be flagged. So the ones that Gabe described, these are things that we include as well. So these categories for classification exist. We'll take them on. We do agree that violence is not part of our compassion coach. So is sexual interaction. We don't want any of those. So we can keep those. But we, as the compassion coach, have more content classifiers that we would want. Why? Because as you saw before, we first need to be able to flag something if we're going to do something about it. And there are things that we want to do to protect patients. So here are the things that we add, and this is in addition to everything you've seen already. So we have content classification for medical and diagnostic advice. So if a user says, I'm really concerned about my breast cancer biopsy, and I think that it's going to say XYZ, the compassion coach will say, well, I think you should talk to your provider, but I can be here for how you're feeling about it. And so it's important that, because large language models can respond about anything. And the idea is to make sure that it doesn't, and it stays within the bounds that we want to provide to the patients. And for us, we only want to provide compassion. So then out of scope topics, we want to prevent AI psychosis. AI psychosis, for those who have not seen the many headlines lately, is when people have a psychotic breakdown after talking to AI. And what that looks like is they have lost touch with reality. They've gone down many rabbit holes, and they are disconnected from society in terms of grounded reality. And this is actually very real and very sad and very dangerous. And so we want to try and avoid that. So any kind of like conspiracy related talk and all of that, or anything actually, frankly, that doesn't have to do with providing compassion. So If a user wants to talk about sports, wants to talk about science or politics, that's a no-go. Of course, the compassion coach politely says so and provides compassion instead. Flirtation, as you saw with the example, that's something we want to avoid because the compassion coach is a coach. It's not there to flirt with you. There are other AIs out there whose intent is to flirt. That is not us. And so for us, we want to bound that. And so in our training data, we have examples where the user can say something like, oh, I wish you were my boyfriend, or I wish you were my girlfriend. And the response would be, I'm your compassion coach. I'm here to provide that, and I cannot engage in these things. So we create a hard stop. So something like what happened to that 70-year-old man with dementia would not happen. Same thing with friendship and companionship. This is a very fine line, and we want to stay firmly on the side of being a coach. Just like a human coach is not your friend and is not your companion. They are your coach to be there for you for a particular type of coaching. The same thing with the compassion coach. So all in all, we're providing boundaries to remind our users what the compassion coach can offer them and be present with them with compassion and nothing more. So like we said before, it starts with content classification. So here I showed you we have other content classifiers. And this is to maintain the boundaries and the guaranteed use of our compassion coach. Then after that, content classification, as you saw, is not enough. You need to have intentional responses. And I verbally told you some of the many responses, but here you can see some of them in each of these categories. And these are pulled from our training data, so you can see some examples of how we're training it. Now, something I want you to pay attention to is the notification mechanism. So if, for example, we have a situation like a crisis, like that teenager who talked about self-harm, because this is for a healthcare provider, we would have it in a dashboard where somebody would be notified, their doctor or somebody who the hospital or healthcare system deems the right person, the right human to contact. And in the exact second that that message is received and processed, a notification mechanism, whether it's an SMS or an email, will be sent immediately to whoever the healthcare provider decides should receive it. So it could be their doctor. So for example, again, let's use cancer. So if somebody going through chemo starts to have express self-harm language, the oncologist could receive an email about this and then respond. Of course, there'll also be information for them to reach out to a helpline that they can use. Same thing for treatment, because this is for health. If a patient wants to ask questions about their treatment plan, we'll let their doctor know that they have doubts about this and they need some help. So all in all, this is kind of how we see these parameters. It's important not to make the chatbot addictive. A lot of people ask us about engagement, and that's not a metric for us. For us, it's patient outcome. If patients are happy using it, that's what matters to us. What we're seeing is from our testing right now is that people like to use it once a week, maybe once every other week, but it's really when there's a health situation that comes up that they feel anxious about, that they want to use it. So it starts with classification, classifying the content. Otherwise, you can't create a response if you haven't flagged it. But after that response, there's also the idea that you're not trying to manipulate them. I know this sounds maybe obvious, but a lot of AIs are actually designed to keep people on, and we do not do that. And so I think that's something that, particularly in the healthcare world, we should think about. So this is basically our approach. It's a bit like a sift that we're slowly kind of looking granularly at the content, trying to filter it out and making our patients safe. And I hope that we have convinced you that it is possible to thoughtfully design safety in a chatbot.